And the CDC considers new guidelines, all because of Omicron. Daryl Forges has more.
Omicron is very transmissible variant, but much different than anything we've seen before.
COVID positive case numbers continue to increase, and so are hospitalizations.
Unvaccinated are taking up hospital beds and crowding emergency rooms and intensive care units. That's displacing other people who need access to those hospitals.
According to data from the Department of Health and Human Services, more than 110,000 people are in hospitals with COVID. That's more than 60% higher than 2 weeks ago. The CDC says the majority of those hospitalized are unvaccinated.
Our vaccines, especially when combined with our boosters, have remained extremely effective at keeping people out of the hospital and at saving their lives.
Pediatric hospitalizations are now at record numbers. The CDC reports more than 500 children admitted each day last week.
So they're getting a lot of respiratory symptoms, as we've been expecting. Pneumonias, needing respiratory support to help them breathe better.
This as the CDC is expected to update its guidance on the recommended isolation period, according to a source familiar with the plan. Some health experts believe there is a way for people to live in the world of COVID.
We don't ask people to stay at home, but we say in public indoor settings, everybody should be wearing high-quality masks. We are requiring for people, I believe we should require vaccination and boosters for places like restaurants and concert venues to further reduce risk.
I'm Daryl Forges reporting.